Hey, I'm Nikki.
Hi, I'm Maya,
I'm Jesse.
and this is our Biomechanics video report.
What is the difference in optimal release angle for a client 165 cm versus 189 cm tall when performing a basketball free throw?
Both clients will be using the same size 7 molten basketball weighing 620 grams. The ring will be set at the standard height of 3 meters and they will be throwing the ball from the standard free throw line, which is 15 feet away from the ring.
Both client A and B will take 15 shots each. Two apps, Huddle and Speed Clock, will be used in order to collect the raw video data for each shot. Huddle was used to calculate the angle of release, while Speed Clock was used to calculate the release speed. These videos will be filmed standing in line with the client, but 5 meters to the side.
These are the biomechanical principles that we will be discussing to help answer our question.
The next two tables show 15 shot attempts by both client A and B. From the results, the averages were calculated for both angle of release and the speed of release.
We have broken the free throw movement into 5 different phases. We will discuss each of the biomechanical principles that come into play at each phase individually.
In the preparation phase, both the clients can be seen to be starting with their legs about hip width apart. They've also got their feet slightly staggered with their right foot forward, creating a bigger base of support. They both also have their knees slightly bent, which helps lower their center of gravity closer to the ground. Both of these actions help to create better stability in preparation for the shot. Because of this greater base of support, it takes a lot more movement for the person's center of gravity to fall outside of their base of support, which causes a disbalance.
It is interesting to look and compare client A and B's center line of gravity from their starting positions. It can be seen that client B's gravity never leaves his base of support as it just shifts directly upwards. Client A, however, is setting herself up in a way where her center of gravity will be shifted outside of her base of support in a forward motion. The reasons for this difference will be explained later in more detail.
Phase 2 is where the clients accelerate to gain momentum from a transfer of potential energy from their body to kinetic energy to the ball in order for a free throw to occur. As the client is accelerating up, the concept of Newton's second law, F equals ma, is in place. The clients are applying more force when they're vertically standing up against gravity, known as the propulsive force. As it's a positive, they're accelerating up. The acceleration is produced when an unbalanced force acts upon mass. Relating to Newton's third law, where every action has an equal opposite reaction, in this video it is the relationship between the client and the ground. When initiating that vertical jump for that shot, as the client pushes down on the ground, an equal and opposite reaction is created up against, causing them to accelerate vertically, which relates back to Blazevic's 2012's article. Newton's third law also relates to the conservation of angular momentum. As seen in the video, client A extends out their back leg when jumping and pushes their arms forward to counteract, causing the system to be balanced. This is because the angular momentum of the upper body and the lower body remains equal and opposite and keeps the client from jumping in a forwards direction, as external forces such as gravity will affect the client's stability, whereas client B keeps a neutral position when jumping. Newton's second law relates to the impulse-momentum relationship, as the change in momentum of an object is equal to the impulse applied to it. Analysis of the positive impulse a client performs will change the momentum, propulsive force, and acceleration. If we can increase our propulsive force while applying force in the same direction, we will cause a greater change in our momentum that translates into an increase in velocity at takeoff. In the results, client A has a greater velocity average of 6.01 meters per second compared to client B, who has an average velocity of 5.631 meters per second. Therefore, client A uses more momentum than client B to throw the ball.
Phase 3 is the release. We'll be looking at the relative release height, projection speed, angle of muscle orientation, and the projectile angle. The release angle of the ball is largely influenced by the relative release height of the thrower. The difference in height from client A to B is 24 centimeters, which will affect the arm length also, meaning client B should have a greater relative release height. However, there is also the factor of technique that affects this. As we can see from the images, the techniques are quite different, with client A releasing the ball much further forward than client B, lowering their release height even greater. The next factor influencing the release angle is the speed of release. After 15 attempts each, the average release speed of the clients is shown. Client A releases the ball at an average of 0.38 meters per second greater than client B. This speed increase comes from the position of where the ball was thrown from. Client A's release position is more anterior and lower, bringing it closer to the chest with a more outwards push. This is compared to client B, who pushes the ball in a more vertical, superior plane, as shown by the ball tracking in red on the photos. Due to the muscle orientation and the way the fibers are structured, more force can be produced when using the larger muscles like the pecs and deltoids and propelling the ball forward rather than up. It is then reasonable to assume that the force generated by client A is greater than that of client B. As the ring is much higher than both the client's release heights, the height of projection relative to its landing level is negative. This means the angle that needs to be thrown to make a free throw must be about 45 degrees or higher. If we have a look here, we can see the average release angle of client A and B and very similar numbers on a shot that they successfully got in. Interestingly, client B, who has the higher release height, shot the ball at a greater angle than the lower client A. These results are the opposite of what is expected and largely come down to technique. The increased speed and release from client A explains how the lower release angle achieved the same range and landing level as client B. Here is an example of how it works using high quality stick figure drawings.
As we've seen in our results, client A has a lower release angle and a faster release speed. Now, if the angle was still different for client A and B, but the speed was the same, this is what would happen. So client A would shoot and it would drop short, whereas client B, because of the high release angle, would make it to the rim. Now, because we are changing the speed of the release, client A now shoots like this on the same angle, but as it goes faster, it reaches the rim like that, whereas client B still stays the same and goes in.
To see this from both clients, we have put together a video of both throwing together to show the difference. As we can see here, the trajectory of the basketballs is significantly different. When looking at the shot chart, there is a correlation between the release of client A being lower and the number of attempts they hit the backboard. Here we can see that they hit the backboard 10 times with only 2 dropping short. If we now compare this to client B, only 7 attempts hit the backboard and 6 dropped short. This is a significant difference and shows the importance of the 4 intrinsic factors affecting a projectile's motion. When looking at levers, there are 3 types, and these are described as class 1, 2, and 3. The differences between them come down to the placement of the fulcrum or the pivot point, the resistive load or the weight, and the force or effort on the lever. Class 1 levers involve the fulcrum to be in the middle of the lever with the effort and load on either side like a seesaw. Class 2 levers have the load in the middle with the effort and fulcrum on either side like a wheelbarrow. Then we have class 3 levers, and these are the most important to the free throw. Class 3 levers have the effort in the middle with the load and fulcrum either side. Looking at this diagram, we can see the lever in action. The load is the basketball about to be thrown, the fulcrum is the elbow, and the effort comes from the tricep muscle, which is connected to the forearm between the two. So, how can levers be used for a mechanical advantage? The length of the lever itself has an impact on the force needed to move and speed that it can be pivoted. Longer levers can produce greater force, whereas smaller levers can rotate faster. For the action of a basketball free throw, if greater force can be achieved for the same energy, it will be more efficient and easier to make the distance with the correct flight path. The lever in this example is the arm length of the thrower. Client A has an arm length of 66 cm, while client B has an extra 9 cm on top of that at 75 cm. Technically, this would mean that client B has a mechanical advantage over client A, but, as discussed previously, their techniques were very different, with client A using different muscles and therefore changing the dynamics of the lever system, but it is still worthy to note the biomechanical principles behind it.
In phase 4, the flight phase, there are many factors that can affect the ball when it's in the air. As seen previously, the release angle of the clients is different, affecting the parabolic flight path and its time spent in the air. When the ball is in this flight stage, the Magnus effect becomes present. According to Nikolic et al., the Magnus effect is responsible for the swerving of a ball when it's thrown with a spin. This is seen as client B places backspin on the ball for each shot.
Alright, so as we can see, when client B threw the ball, they threw the ball into the goal with a bit of a backspin. So that's something we call the Magnus effect. So the Magnus effect is if the ball is travelling in this direction with a bit of backspin, it causes this low pressure or fast moving air over the top of the ball because that's the direction that the ball is moving. This underside of the air, as known as the high pressure system, is going in a sort of an opposite direction, so it's more dense or slow moving air, as we can see down here. As these two pressure systems arrive and collide at the back, it causes an uneven pressure, which the universe doesn't like, so it creates an opposite reaction where the ball will then push against this high pressure system and react and move in an upwards direction.
Although there are many different factors at play that have to be taken into consideration, a study by Tran and Silverberg found that giving the ball 3 Hz of backspin, or the equivalent of 3 full rotations from leaving the hands to the net, allows for the most beneficial Magnus effect to be applied to the ball.
Both clients are deaccelerating to land, a negative impulse is created and will result in a change in momentum to decrease, exerting a braking force, and they are absorbing different external forces. A study by Wolf in 2003 explored how 2 different landing techniques affect how much force is being absorbed. Client A lands with 1 foot, whereas client B lands with 2 feet. By landing with 2 feet, it allows for the force to be dispersed between both legs, therefore lowering the chances of injury. As client A has a greater average velocity, more force, and is landing on 1 foot, the more force has to be absorbed when landing compared to client B. Therefore, client A's collision of velocity is greater than client B's, meaning the coefficient of restitution will decrease and client B will have the opposite effect.
Yeah. The surface conditions have different force absorption characteristics affecting the coefficient of restitution. As it is a hard surface, the joints in the legs will need to bend in order to absorb the force rather than landing with a straight leg to prevent injuries. From this report, we have drawn some conclusions for both client A and B.
Client A's results show that the shots were all low and hard. This is due to a low angle of release and the ball being released at a high velocity. From the report, findings show that client A would benefit from increasing their angle of release and decreasing their release velocity to free throw the ball more confidently. Client A would also be seen to benefit from adding some backspin to their shot, as they're not making use of the full benefits of the Magnus effect.
On the other hand, client B results indicate more force needs to be applied for a greater acceleration, as the ball didn't always make the distance. This can be achieved by bending the knees more to increase the momentum in the preparation phase to have a better propulsive impulse. Client B should also release the ball at a slightly lower angle, as the ball needs to travel further horizontally. If the angle is too high, more energy is placed on the vertical trajectory, causing the ball to lose distance and fall short.
To answer the question of What is the difference in optimal release angle for a client 165 centimeters versus 189 centimeters tall when performing a basketball free throw? Roughly a 4-degree difference was found. Our results show that client A's optimal range of release should be between 50 and 52 degrees, with client B's being between 48 and 50. We came to this conclusion by comparing and analysing the data and video footage. Although it was a hard comparison due to very different shooting styles and techniques, when applying different biomechanical principles together, the main findings from relative release height, speed, and angle of release indicated that these results would optimise the performance for client A and B.
This information can be used as a base tool for anybody interested in the biomechanical principles involved in a basketball free throw. It is valuable for sports coaches and players both at elite and novice levels, as the principles spoken about can be manipulated and trained accordingly. By the action being broken down into 5 different phases, it allows for both players and coaches to identify any specific areas that may need improvement. For example, if the player feels unbalanced when taking a shot, we can look at phase 1. If the ball continues to not make the distance, we can look at phase 2 and 3.
In some cases, the use of doing a biomechanical analysis of movement can also help with things such as injury prevention. For example, as mentioned earlier, if client A was experiencing knee or back pain when taking a free throw shot, by the information provided by this biomechanical analysis, we can see that this may be occurring during phase 5, where they are landing on a single leg.
Although there will be differences, some of the same key principles such as angle and speed of release, the Magnus effect, and Newton's 3 laws from this report can be carried over into the analysis of many different sports. This can include shooting a goal in netball or in soccer, or even hitting a golf ball. Although all of these may seem to be different, each movement still can have an optimal angle of release. This angle will also change depending on the individual's height.
As we're all furthering our studies to become teachers, this information can also be useful within our future practice. By understanding the key basic principles, it allows us to teach and adapt movements to help optimise each individual's performance. For example, if a student is struggling to reach the ring when throwing a basketball, there are many elements that we can change. This can include using a smaller ball to help reduce the amount of force an individual requires to take the shot. Another example could be if the student continues to throw the ball under the backboard. We can recognise that the student needs to increase their angle and speed of release. Thanks for watching our Biomechanics Reports video.